updating that temporary order in line with this new executive order. And we will be sending out a communication via email and via mail to all providers as soon as that is up to date and ready to go. We are trying to get that out as soon as possible, and to make it clear that if you are operating currently emergency child care, that you can continue to operate, and if you are willing to meet the requirements related to emergency child care, you can continue to operate. We are working on kind of additional tools, such as how to stay, how one kind of goes through this process, how to prioritize families under this order, and are also working on financial support and messaging that are likely to come out today. So all of these kind of terms that seem loose to you will be further defined in all of those, such as essential worker. Right now, the universe that we're planning to use is around the Department of Homeland Security guidance that is pretty broad on who can be determined an essential worker, in order to kind of we know lots of people are still being required to go to work, and so to keep that definition broad, and then providing additional guidance to child care providers on how to possibly prioritize within there. Again, this wouldn't relate to programs that have already been stood up to offer emergency child care, like schools, like those that have opened in partnership with hospitals, and other folks that are already doing this. So I will, I think, stop there, and we can revisit the chat to see if there are questions that we need to answer.
So Sarah, we have a question around 10 children per classroom or per facility. Do you want to clarify that first?
Yep, so per classroom, and we're working on being clear in our guidance. So being that limiting to 10 per classroom will also then, of course, limit the overall facility kind of capacity, or children that are in one facility. This is, of course, in concert with the guidance that already exists around things like limiting how many groups, limiting it to one group outside, staggering schedules, making sure no group is really within any area within a child care at the same time, to reduce the number of children, because we know that children are not great at social distancing. Neither can staying 6 feet apart from each other at all times really be an expectation we hold of children.
I think you've already addressed how is this being communicated to providers, and we'll actually talk a little bit more about the registration process that's going to be launched more holistically, so we can talk a bit more about that after, because I know you only have a limited amount of time to be with us today. Eva's wondering, will providers use the school district toolkit, or will that be different?
Yeah, we are working on separate guidance for licensed providers.
Because right now we have two toolkits up. Do you want to just say a little bit about what's up right now, and then I think that makes sense of what we're adding.
Sure. So there are 2 toolkits up. Thanks, Joan. There is one that is for school districts, for the governor's guidance last week, to offer care, and their care is really focused on, although not exclusive to, frontline healthcare personnel. So that guidance will remain up. I think we will need to change a few things there, and so we'll notify all folks when guidance is updated. There is also a second sort of toolkit for emergency childcare operating in a new space. So existing providers or experienced providers who might be opening, say, within a hospital space or within a school space or within another space, to partner directly with an employer in order to offer their staff childcare. And I know lots of you, if not all of you, have been involved locally in those sort of efforts. So this guidance will be aligned but different, because this is just folks, applies to folks who are using their current facility under their current license, who want to remain open for this purpose. So it's temporarily operating as emergency childcare rather than under the typical sort of licensing rules that they do every day.
Hopefully that answered your question, Eva. So there'll essentially be 3 sets of guidance, and those will all be posted on our website. And of course, that's the best place for people to go, because as we need to make updates to them, that's where we'll update them first. So I think if we keep directing people to the website, that's going to be the best way to make sure that what they're pulling down, or you're pulling down for them, if you're talking with them, is up to date. Let's see. Jennifer, I'm hoping you got your question answered. Like, the first step here is, if you want to remain open, you have to register as emergency child care. And we'll be talking a little bit more about that process in a minute. And then you also have to be caring for essential personnel. Both those things have to be true for you to stay open during this time and follow the guidance as well. Nancy, did this hospital child care program like pop up, and is it registered with the state? Did they go through the process to register this?
This hospital program has been a licensed child care program at the hospital for the last, 25 years. So they have always been there. I talked with the director this morning and to find out what her numbers were. Right now their numbers are very low, but they are top priority for medical staff, but would be willing to take like first responder, some of those folks if they need care.
Okay.
So my question is, they have to register, but they don't have to like close and then register, right?
Correct. Yeah.
Okay.
Yeah, that's correct. Yeah.
Okay, good, because that would be a disaster.
Yeah, absolutely. Absolutely. We have a question. How is the determination made regarding whether the children in care are part of the essential workforce? You want to answer that, Sarah?
Yeah, so we're working on guidance for that right now. I do want to clarify that operating emergency child care really means you're prioritizing essential care staff, not necessarily that you, and it means you're not serving children of people who are, families that are required to stay at home. I would caveat this to say we're not going to be going around policing this. I don't say that to tacitly encourage that people should just stay open and serve whoever they want. I just mean we are not trying to put an undue burden on child care providers to kind of do some verification and check. I think what we are expecting is that most families who fall into this category will be accessing this care through 211, who's prioritizing them, or we are also working on getting up a list of emergency child care and limiting NACRAWare to those folks. So it's more that they would be opening spots to people who are needing child care for that reason, not that they are needing to keep any verification record of that. I think that would be a really burdensome process for individual child care providers to have to do. If that kind of helps answer the question, the guidance will help include kind of how essential personnel will be referred to them, who's considered essential personnel, and that they are definitely both free and encouraged, and they can connect directly with the program. I see that pop up. So I think we're just trying to say you can connect, of course, you can see a list, you can call the program as a family member yourself, but there's not like you have to, provide your pay stub and other things to show that you're an essential employee. I think we are counting on Oregonians to be able to do this. What we have heard from childcare providers, though, is a want to be able to say to parents who might be teleworking and want to bring their kid in because they're, they need some peace and quiet, that they are allowed to say, no, we are not serving you. We need to prioritize other families at this time. So we're kind of working through the guidance of how to get that out to folks.
Sarah,
now.
this is Margie. I just want to let folks know that we're tracking the calls coming into 211 and who the people are, and they are all essential workers or emergency health personnel. So we have just some modified definitions. So being able to track that, but there are no calls from parents who just need childcare because they're going back to work. It's all because they have to work. They're essential workers. So just so people know that's happening now, the ones looking are the ones who we would see in those categories.
Yeah, thanks, Margie. We have another question about the definition, and yes, there will be a definition. I believe that childcare workers are considered essential. Is that correct, Sarah?
Yes, absolutely.
Yeah, and teachers returning to work in childcare would be considered essential as well, I'm assuming, under the same definition.
Mm-hmm.
Jerry's wondering about whether or not the children of grocery store workers would be included. I'm assuming yes. Yeah.
Mm-hmm.
And it is, will the CCR&R stay open with the changes? That is our intention, that you all will be staying open because you have important work to do in terms of helping us continue to understand the availability of emergency care, in providing consultation to these programs around their operations, as we've discussed before, and supporting the toolkit. And we can talk other important and essential things that you continue to do, but we are not shutting down the CCR&Rs at this time. So, there's a question about, has there been any discussion about providing health insurance, OPH, for providers who want to remain open and offer to watch children?
Yeah, that's a great question. So I will say I don't have a lot of details that I can share because we just developed a proposal and haven't gotten total green light on incentive payments in addition to the base rate for ERDC, but incentive payments to folks doing this emergency child care that would go towards staff payments. We haven't, we've brought it up, but haven't really discussed health insurance in particular, and more of a kind of additional wage that providers, that individual educators within a program would be able to have as a wage enhancement, which then could hopefully be used for either subsidized healthcare and other essential needs for them. And we'll continue working through that and kind of pushing on that issue.
The guidance on numbers for family-based care, is there anything different from what you've shared, Sarah, that you'd want to add?
I don't think so.
Okay. Just a comment that there are centers that do not have 4 walls and a door between classrooms. Will the guidance address that?
I think these are all great issues that we can bring into the guidance to make sure that there's that it is addressed either in today's guidance or ongoing and kind of questions. We are trying to vet all of these things. Well, we are vetting anything kind of related to public health and infectious disease spread and COVID-19 with OHA, so that sort of slows our ability to rapidly answer those questions. And don't mean that as a criticism, it's just sort of a fact of making sure we're actually putting out sound public health guidance. And so we will, I think these are great questions, and if we can't answer them now, it's great to hear from you all so we can make sure that they do get answered either today or really soon.
We have a question about if a site cares for emergency workers and others, do they have to let their non-emergency care go for now? And I'll let you just reiterate what you think is the best way for folks to address that.
Yeah, I think that is partially why, though it would not make sense for, let me see, all programs to kind of go through this close and reopen process. I think it is why we're suggesting it for some programs so they can kind of prioritize within their total capacity. They, again, the word is really prioritized, so no, I would not say under the executive order they cannot care for any other children, other groups. We are, I think, wanting to include in guidance as well is, say, for example, families involved in child welfare, it may be beneficial to the children to be kind of out of the home and in care, and, you know, providers know their families better than, of course, we do, and so we can't account for all of the nuance. I think we will try to do our best with the guidance, but that's an important question for us to mull over to make sure we give a clearer answer than I'm able to give at this exact moment.
Yeah, it looks like we have a couple other questions around the should programs exclude children, which it seems like would be important for us to address. We also have Carmen, who shared some information around guidance in Georgia around, you know, one teacher per classroom and no combination of classrooms. And I think there's a version of that kind of in our executive order when it says that should be the same children every day, same classroom. So I think a lot of states are, I think, trying to help and learn from each other about practices. So certainly if you all see other practices you think would be helpful for us to help with guidance, please send them our way. Let's see, if schools are the main contact, emergency provider families are not contacting 211, how will this be tracked, etc. So there's a lot going on with getting people connected to care. I'll let Sarah talk a little bit about kind of where things stand with that, and I can add if there's anything else.
Thanks, Joan. I thought you were going to take that one.
Or if you want.
Yeah, I think I would just say that it is, we are trying to centralize and kind of understand the state of emergency child care, but are kind of limited in our ability to centralize everything, including some, I think, really great partnerships happening between employers, healthcare employers, and say like their most adjacent school or something like that. So we are definitely trying to track the data and work through these issues as we go, and definitely appreciate suggestions, things you want to flag that are happening in your community to be sent to us really at any time, because as much as we are trying to collect the information, sometimes, you know, much sooner before we're able to get to something. So Joan, anything, sorry, you want to add?
I just would also say that we have a team of ODE and ELD folks who are really coming down on this school-related care issue to try to get many more of these questions to be clearer, clearer answers. Some of us were on a call with Colt and some districts yesterday, so I guess I want to communicate to all of you, we understand these are questions that we don't all have answers to, but we're working as quickly as we can to get access. And we're starting to see, for example, some hospitals working directly with a particular elementary school or several elementary schools. We're not trying to get in the way of that. We want people to register if they're doing emergency child care. We want to know that because we want to make sure people have supplies. We want to give them access to staff and substitutes if need be, but there's not going to be one way that this is probably going to work, and we're all going to have a little grace with how it's going to roll out. We are still obviously relying on 211 as a primary child care referral because not all families will access care through school. Some will want to access it in another setting, so more soon. Taya is asking a question about guidance for setting rates. Will there be subsidies for care?
That's a great question, Taya. As far as rate setting, I think it's one we're trying to work through and aren't quite there. As far as subsidies for care, that kind of goes back to our proposal as far as additional incentives. I think for now, we're really focusing full subsidy on the increased eligibility population group, the 85% of state median income, sort of, I think if you think of it as an overlapping surplus, and we are working on this guidance sort of prioritization of position and kind of role, and making less than 85% of state median income as the families we want to be able to fully subsidize. We also don't want and are sensitive to understanding that limiting group size limits revenue for providers. So that's why we're really trying to work on the incentive payment as soon and get that information out as quickly as we can, so they're not sort of asking families to pay kind of double their normal rate or other kinds of things. So I'm not sure how solid we'll be able to get on that guidance for today, but we'll definitely include something, and any suggestions you all have are appreciated as well.
I have a question about after-hour and weekend care. I know John is going to talk a little bit about the survey data that we have back so far as we started gathering data from the potential workforce. We'll come back to that after, because I know Sarah has to leave in just a minute or two for another call. Can that information be shared about parent referrals in Zoho for us? Karen, I'm afraid I don't quite understand your question. I might need either Margie's help or you to mute and explain.
Yeah.
Sorry.
I can help. Yeah, Karen, thanks. I did get that email too, and that's something I'm working on. Sherry and Hannah and all of us are meeting after this, so we want to keep adding data points to that Zoho report that you have, and those would be included. I also am sending regular updates. I'm keeping track of contacts, emails, calls, and texts from 211. So that's a data I'm giving Joan every day, so I can make sure you're all in that loop so you can get it. So yes, thanks.
Yeah, I've been trying to...
Go ahead, Karen, sorry.
That's okay. I've been working with community partners, and they're quite concerned about 211 having the capacity to take the calls, and we're trying to figure out how to connect with all of the hospitals and kind of get a parent survey. So I'm not sure what other areas are doing, but how do we understand the demand so that we have enough supply?
Yeah, let's put a little pin on that, and we'll come back to that, because we can talk a little bit about what we understand about supply right at this moment. Sarah, before you go, I was just wondering if you could talk a little bit. We have a couple questions in here about the stable group, and is the stable group of 10 meant to be the same Monday through Friday? Can be a different 10 each day. If you just could say anything further about that before you go.
Yeah, that's a great question. I appreciate it coming up. I would say, as far as we've gotten now, and I think it would be very hard for providers to operationalize once you set a group. You know, a child will leave, another family will come, and so I think we need to nuance our guidance to that. I think what we intended, or at least what I believe we intended, is really to say, when you come on Monday and you're in the red room, Tuesday you're not in the blue room, and Wednesday you're not in the yellow room, sort of to Carmen's earlier point of not kind of mixing adults and children, is that to the extent practicable, we want children who are within the program to be with the same adult each day. It makes kind of tracking things and any unfortunate incidences that much safer and easier to kind of understand and track. But I think that definitely needs more definition as we put out guidance to providers and in a question. So thank you for that.
So Sarah, I know you have to go. We will, obviously we'll have the chat log. We'll share that with you in case there's any, because I'm sure there's a few other things in there that would be helpful to consider, and probably more by the end of this call. So we can talk
Yeah,
on the backside.
yeah.
Thank you.
Yeah, thank you so much for these questions. They'll make our guidance so much better. And I know that your jobs right now are, demand cognitive flexibility at all times, and you're fielding a lot of questions. And I can't say how much, I'm sure you'll hear this from all my colleagues, but we appreciate you in this time. If it wasn't clear before, which I believe it was, your role in the childcare system in Oregon is essential. So I hope you all think of yourself as essential employees as well. And I can't thank you enough for maintaining your passion and spirit and good humor in what I know is a personally and professionally taxing time for all of us. So thanks for having me. I'm sorry I have to jump off, and I look forward to hearing more of your questions.
Thanks, Sarah. Talk to you soon.
Okay.
Bye. Okay. So I'm wondering if it would be helpful for us to talk a little bit. Let's move and talk about the registering as emergency childcare. And Margie, are you going to talk about that? I noticed Don Taylor was on. Are the two of you going to talk about it? Just wasn't sure how we were going to approach this one.
Well, I could definitely start. And then Dawn, if you wanted to kind of say where we are on some of the process, the forms and that kind of thing, and the timing of everything, that would be great. And fill in stuff I leave out. Would that work? Yeah, Dawn, you may be on mute.
I am sorry.
Oh,
It took me
okay.
a minute to go. Yeah, absolutely. I'll fill in anything I can think of.
Okay. Well, we've been working with Office of Child Care and the Research Institute to sort through this process, and we are identifying, as you know, through the survey that went out, we've been able to identify emergency child care programs, those in our mixed delivery system who want to provide emergency child care, and they have been coded into NACRAWare as ECC. And what we are doing, Sherry has gone ahead and sent that data to the Office of Child Care. They are sorting through the currently agreeing providers who are doing emergency child care based on the survey results and any updates that you have done, so anything that's in NACRAWare, and they are providing those lists to the appropriate licensing specialists. So the licensing specialists, it's their caseloads that they're getting. They're calling those providers and they're asking them if they're willing to provide emergency child care to essential workers based on the definitions we're using right now. And they are gathering information using a registration form. This registration form is similar to the one you've seen for the schools. However, it's being adapted right now for licensed childcare. They will then gather that information, and the information includes the ages of children and the times, the days, and what they're also doing is making sure that the child care providers are willing to follow the new guidelines. They're self-attesting to it. And then they are entering that information into the registration form. They will then attach it to a form site and add the county that it's in, and you, as the CCR&Rs, will automatically get that information. So you will get the registration form, the approval that they're an emergency child care program, and then you will go in and update NACRAWare. So that's the meeting tomorrow, the training tomorrow, to kind of bring you up to date on how to do that with this fairly new process. So expect that, and that's part of why I was bugging you guys all weekend to get your accurate information right now so that we can make sure that it's going to the right email boxes so that your staff can update NACRAWare. So basically what's going to happen is you will be updating all the emergency child care programs that are approved and are willing to follow the governor's orders. And so that will all be in place. There was more, also, once we have the approvals on the schools, and their emergency childcare, their registration forms, you will be getting those as well because we need to get those into the NACRAWare database. Even if they're not always used, like Joan was saying, an example, maybe a hospital is already connected with a school and they're just doing it. We really want to have it in the database just for our reporting process and looking back, because we've never done this before. None of us have ever done this before. So we're hoping it's going to provide us with good information should an emergency or crisis happen like this again. So we're trying to really track as much as we can. So I think that is where we are right now. Dawn, do you want to speak to where the registration forms are as far as timing goes and when this will all start?
Yeah, so
Margie,
oh, go ahead. Sorry. Go ahead, Mary.
I just want to be sure that only providers that have turned in that online survey will be included, or do they still have an opportunity to submit that?
They still have an opportunity, so thank you, Mary. That's good. Here's the other caveat for you all to know, the important piece for you to know. I know you're all talking to providers regularly, so when you hear from them, yes, I really want to provide emergency childcare, and then what you want to do is refer them right away to their licensing specialist. Their licensing specialist will then go through the registration form, and it's a fairly quick process. And then we'll get it back to you to enter into NACRAWare upon approval.
Okay, thanks.
Thank you.
Margie,
Thank you.
can I clarify something real quick too?
Sure.
With as far as getting the schools enrolled, this was some kind of relates to what I was typing in the chat box, but we're not necessarily being looped in on the front end of that. So I'm kind of trying to catch everybody, and it's happening in a lot of different directions. But if we do reach out to them and they're like, yeah, we're already doing this, thank you, we still need to let them know, good, we're glad you're doing it, please let us get you enrolled in NACRA. This is what the ELD has told us to do. Is that right?
Yeah, I would
mean,
say number one. Yeah,
Go
I
ahead.
was just going to say number one, we want to make sure they're registered, Taya. Like that's the first question. Are you registered with ELD? And then Margie, I'll let you say the rest.
Yeah, I was just going to say of course we can't force them to enroll into NACRAWare. However, it is an important partnership. If they should, for example, have space, we would want them that referral process then. And I think them understanding it's part of the referral process. You may have space open, and it's important for parents to know their options. So even being able to talk that way. But on that note, too, Taya and everybody, we do have a team, as Joan was saying earlier, or maybe it was Sarah, that is working with the schools, and and I'm part of that. So they just got pushed all of your information, and I think part of it is they don't quite know to loop in with you at this point. Mm-hmm. So that's going to change. They'll be really understanding more what your role is and why it's important they connect with you. Not only just enrolling in NACRAWare, but also building those, connecting with the infant toddler programs, making sure they have the resources they need, answering any guidance questions around, even what they can provide the children and the social distancing rules and regs, which we will make sure you all have as well.
Okay, and then when you say making sure they're registered with the ELD, I might have just missed this, but they're not registering in the same way that licensed providers, right? They don't have licensors. So how are they getting registered with ELD?
It's in the tool.
I think
so.
In the tool.
I think this is the question also that I want Dawn to answer, because I believe that we're modifying the form so that any emergency childcare program is it one form, Dawn, that we're going to have for everyone, or are we going to have separate forms?
My understanding is that there will be one form for everyone, and the intake will all happen at Office of Child Care, but who gets the different information? So if it's a school district, it will go to Gwen's team to work with and get the information that they need, and then the other applications that we receive will manage. So it's one application.
Okay.
Yeah.
Thank you.
Okay. I didn't know, Dawn, if you wanted to give us any update on timing of when we think the process of licensors reaching out and the form being ready is going to go live?
Yeah, so I'll give it my best understanding is we actually have a very similar call here at 3 o'clock with Office of Child Care staff to walk them through the processes that we've developed for this based on this new executive order. And so my understanding is that the application is almost done in terms of being completed. We will be then, once that is done and put onto the website, staff, and that's why the list that Sherry and Roman are working for to assign the existing emergency childcare programs, they will begin calls immediately with the goal / expectation of having them all completed by close of business on Thursday. And so, or Wednesday, close of business on Wednesday. When we kind of did the math on how many emergency center facilities that we knew about, that's about 20 phone calls per licensing specialist. And then once that initial set is done, then we'll be looking at kind of the next wave. So really looking at getting this all completed by close of business Wednesday.
And as soon as, Don, if you could just shoot like Margie and maybe myself an email as soon as that starts being live, then we'll all let you all know that's a live process too, so you know that licensors are starting to call programs, and you won't be wondering when that started.
Yeah, absolutely.
Any other questions on this registration process at this point?
Joan, I'm just going to put the link to where the current toolkit is. People may already know, but just so you'll be able to see what the registration form looks like for the schools. And you can see where a new, the space for another registration process will be in there, so everybody can see that.
And if I could just add,
sure, go ahead, John.
Sorry, Joan. I guess what I would add is I think that I've been telling our licensing specialists and everyone that to really see where we're at and what's out there publicly, I think that really is the best website to go to see what's out there public facing.
Yeah. We have a question about, can providers continue to provide care until the licensors call them? We are striving to only be operating emergency child care that is all registered with the state by close of business on Wednesday. So obviously for some folks, their call from their licensor is going to be a little bit further out than others, but most people should be receiving a call within the next 24 hours. You know, I mean, calls are going to start right away. So the closure time frame is end of day on Wednesday. Okay.
Joan, this is Christine. I have a question.
Sure.
So should we continue calling the providers that we've not reached to find out if they're open, or should that work stop?
Can I take that, Joan?
Margie. Yes. I saw your face.
Please.
Like, Margie.
Please, yeah, please continue to call your providers. It's okay. And you could even say, you know, I see that you have agreed to provide emergency child care. Please know your licensing specialist will be calling you soon to register you and make sure you have all you need to provide that. So yes, please continue. And then if they,
no, I mean the programs that we haven't reached yet at all, who are not marked ECC yet, because we've not gotten through everybody.
Yes, please do. Please, yes. That's what I meant when I said, as you're talking to them and and you haven't reached them yet, and they're choosing to stay open, refer them to their licensing specialist to get that registration in place. And then, of course, if they are choosing to close, you want to mark the NACRAWare database with the temporary closure, so we can keep that track of that too.
Okay.
All right, we're going to do more. I want to do one more quick. Is there an end date to this mandate at this time? Taya, I wish we knew when the end date was going to be. I think all of us would feel better if we knew. At this point in time, there is not an end, but all of these temporary orders and these various things will expire upon the ending of the state of emergency. So obviously we're going to be hopefully being able to anticipate that as we would start to get close to it and start having conversations about what does it mean to get back to business. And we know there's a lot to talk about. Today's call, we're not going to be focusing on all the things I'm sure everyone's minds are spinning about what this is going to mean for the field and the work we're going to have to do to get people restarted, but we will have those conversations together. And I'm just going to have us, we will respond to the stuff in the chat box. Denise, I want you to talk about where things stand with supplies, which will now be targeted only at emergency childcare. So can you give us an update, Denise, on that?
Absolutely. Hi, everybody. Denise Swanson here, and I met with DAS Procurement today. So just to give you a quick update, what's happening is we're in process of ordering supplies. They're going to be delivered to a warehouse in Salem, and we're going to have an order form that will be populated. We'll change it on a daily basis as supplies come in because we won't wait. So if we get gloves and formula first, we'll put out that is a list that people can order. Those supplies, thanks for all the good information about distribution, but what is going to happen is the warehouse, when they take the order, will mail the supplies or UPS the supplies directly to the provider, which is awesome. It just takes us all out of the middle of that and gets them what they need in a timely manner. And the only folks who will be able to order supplies will be those on the emergency list. So I'll be working with somebody on our team to get me those providers as they come forward, and then those providers will be sent the form on a daily basis of this is what's available today. We'll have a little bit of limitations right in the order form to assure that we have enough supplies for everyone and that we're keeping enough to go over, an extended period of time as well. When I look at the things that we've ordered and the amounts that we've ordered, I don't believe that we're going to have any issue in keeping people supplied with what they need. What we've heard from DAF so far is that the hardest thing to get, no surprise to anyone, are gloves and hand sanitizer, but we've got everything from diapers to masks and all those things that came in on the list when we did the survey and asked providers what they needed. So more to come. DAS believes that the first supplies will be dropped by midweek. So to me, that says Wednesday. We'll send out probably I'm putting together just a one-pager that'll go with the order form that tells folks how to do the process and what's available, what the availability is, and how much they can order, et cetera. So that's where we are. As more happens, I'll keep you guys updated.
And then, John, I'm hoping you can pop in and let people know where we are with the substitutes and staff for emergency care. I noticed we had some questions about that too.
All right. Hi, folks. Yeah, so over the, I actually put a link into the chat box just so in case any of you were needing to direct people to the opportunity to sign up to become a sub. Now that this new information is out, it could create an additional flurry of people trying to seek opportunities to engage in some form of employment if their employment situation is changing. So anyway, over back to Friday, you hopefully all received correspondence and a letter that Miriam drafted that described the process around recruiting substitutes to either work in emergency childcare programs or work as people who can fill in various capacities. But we had 3 different ways that this could work. They could go into our school-based programs that are being set up and operating to work with emergency responders. They could help supplement if, and now it's shifting a little bit, but they'll be able to help supplement for our childcare programs that are going to sign up through this process to become sanctioned to do the emergency care. They'll be available to be mobilized to help them out. And then also potentially on certain basis for emergency responders that may need to do some evening or overnight care, that may need to go into work evening or overnight in healthcare or medical staff. I think it's going to be really important to allow some of these folks to go into the family's home to help out in some capacity. And so we'll have a process around how we link people up for that. But I just wanted to give you a little bit of an update real fast here. When that was released on Friday after TRI put it all together, we, within an hour's period of time, had 360 people jumping in to try and utilize that system to sign up. We've had over 800 people at least going in to try and access it over the weekend. And right now, as it stands, there's 353 people who truly completed the entire sort of process, in a sense, to sign up to be considered as people who might want to be mobilized to be substitutes in different environments. And so just to give you an idea of what we have here is that we asked several different questions, but we were seeing if we figure that this may get out to people who aren't currently working in the system, but we wanted to know if people have worked in early childhood programs in the last 6 months, and it was 332 of the 353 were doing that. We have information on whether or not they feel that they're current in their criminal background registry, and 322 out of 332 responses said that they were. So I think what we have here is, and I should have mentioned this on the front end, this went out to everyone in Oro who is a current sort of active participant attached to a facility. So that was over 17,000 people who received this correspondence over the weekend. And so what we are finding is that a majority of those people already have criminal background registry clearance, which is really good when we're talking about mobilizing people to get engaged in these opportunities. And the people that responded, there's quite a few of them that were directors or are directors, head teachers, in-home childcare providers, assistants, aides. We have representation of basically every county, at least some respondent from every county, even if it's one or two. We have people interested across the board. It'll be interesting as this thing rolls out how we might look at potentially continuing to forward it on to people who might be interested in helping out in some capacity, because we have some counties that are a little lower represented in people who've been interested so far. But again, this went out over the weekend. And what I can do is get this information out to you so you can see the sort of breakdown of what people have come forward at this point, not any information about them, but just knowing what their current, in what counties people have currently been interested to potentially provide this care. And the good news is they're willing to do this every day of the week. Some people, and I would say almost like 3/4 of the people who responded said they'd do everything from overnight to late evening care. The types of environments that they would be willing to work in are pretty much across the board. Almost all of them are willing to work in different types of childcare settings, including in the child's home if they were asked to do so. And many of them, about 294 of those 353 respondents have experience working with infants and toddlers. So I think that's really good when we're thinking about mobilizing folks. About 254 have experience with school age and many of them said they didn't necessarily have a preference which environment they worked in, but we had a large grouping that were interested in infant, toddler, and preschool age care. And so what we're doing at this point in time is really just ensuring that we're understanding how this is rolling out with the facility side of things. So as those programs start to request access to continue doing emergency childcare, or to start doing emergency childcare for first responders and essential personnel, that's the point in time where we're going to really want to know from those folks if they're going to need additional staff in order to continue doing the work. And at this point, we're planning on having that connection made with the folks at TRI, because they're collecting the most data around the individuals that are interested. And I think it makes the most sense to have them have a specific conversation with the facilities that are in need of people, just so they can really understand what it is and then make the link and make the connection. There may be very distinct points where we want the CCR&R to engage after those connections are made, just for technical assistance purposes and other things like that, and we'll make sure those communications are good. But I'll pause there and see.
I wanted to say we had a question in the chat box about who's going to pay for the subs and these individuals. At this point, you think back to what Sarah said, we're trying to figure out if there's financing and what that might look like. But at this point, the program would be paying for these subs or staff. And if it was an individual that wanted someone to come into their home, then they would be making that arrangement and that payment themselves. We are hopeful that we might be able to do some things that would make it possible for programs to have funding that might help them pay for these folks. But we don't have a funding source available to us yet that would provide, for example, these things free of charge. The supplies are all paid for. Those are going to be available free of charge. But these substitutes and staff would still have to be paid for by the program at this point, unless we can work out another financing mechanism.
And there were, it seems like, a few questions here that really relate to similar things, as far as how do the programs connect with TRI, or who at TRI is doing the connections. And I would say at this point, if programs are seeking this information about substitutes, I think they should contact the CCR&R helpline, and they'll get kind of triaged within TRI to who would be helping them do that. But I think what we're waiting to find out a little bit more about is, as programs are signing up with the Office of Child Care and being sanctioned, those programs will be connected over, so TRI is aware of who they are, and that is kind of the place where we'll start to find out from those programs if they're in need of additional staff. And I'm hoping what we can really have licensors be doing, and kind of this is a response to Dawn, I'm hoping that licensors, as they're interacting with these providers that may want to be emergency care providers, that they are aware that there may be additional staff that could come in to help them. And then we, if the licensors take that down or tell them to contact TRI, then we can make those links and those connections. But they'd make that contact through the CCR&R helpline.
So what we're imagining at this point in time is that we're not really going to be promoting the availability of staff and subs until we have the universe of emergency childcare known, which will be hopefully mostly close the business on Wednesday, and then kind of lifting up hopefully on Thursday, latest on Friday, being able to communicate about the availability and the process. So if you could hold that information until we get clarity about who is registered as emergency childcare, and then we can start to really push this information about supplies and staffing towards them, because we don't want to inadvertently promote somebody staying open because we gave them access to staff and supplies. Like, we really need people to make a very serious decision here, and to do that in a super thoughtful way. We have a question about, is everyone that's approved as a sub will have everything that's required? What we will be doing, so the reason we went to Oro first is because we thought those were our highest qualified people who'd been through the full criminal background check and also all the required training. But under the temporary rules that were issued by Miriam last week, people are able to come in and staff and go through a lesser background check and lesser training. So we're hoping that, you know, as this process unfolds, that's why we started with the folks in Oro first. We're trying to get the highest qualified people first. And then if we need additional people, we will push this link out further to what could be a much broader universe of folks who will not necessarily, because of this emergency and all the ramifications of it, will not have necessarily the same qualifications, but they will meet our temporary rule. No one will not meet at least the temporary rule requirements. And I know we are at a little over time, and I want to say that we so appreciate, as Sarah said, everything that you all are doing. I love being able to see all your faces. I know how hard you all are working. We can't thank you enough for your partnership. Please circle back with Margie and John and Lisa with specific questions. Help us help you by knowing what your questions are so that we can try to work with them. We'll keep you in the loop, as we've been trying to do. We will continue to do, to tell you as soon as we know something, you will know it as soon after as we possibly can. Thank you very much again, and I'm sure we'll be in touch very soon. So take care, everyone, and be safe.
Thanks, everyone.
Bye. Thank you.
Bye.
Thank you.
Bye, everybody.